So, hello guys, welcome back to my YouTube channel. I am Divya, CPC certified medical coder, and today I'm going to explain a musculoskeletal system topics, and these topics are arthroplasty and the arthrodesis. So, we'll discuss their definition, indications, what are the ICDs and procedure. So, uh, without further delay, we'll continue our topic, the arthroplasty and arthrodesis. Okay, so let's get started, guys. The arthroplasty topic. So, what do you mean by the arthroplasty? So, here we can divide it into the two parts, that is an arthro and the plasty. So, arthro means in joint and plasty means repair or to replacement or to reconstruct. So, the repair of the joint is known as the arthroplasty. So, in the medical term, the arthroplasty is a surgical procedure to reconstruct, to resurface, or to replace of damaged joint in order to relieve the pain to restore the function. So, the common joint were the knee, hip, shoulder, ankle, finger joints, and etc. And it is commonly known as the joint replacement surgery. Okay, so these procedures were done when they're severely affected by conditions such as the osteoarthritis, rheumatoid arthritis. So we'll see what are these procedures, what are these conditions are. So these why arthroplasty is done. So arthroplasty is done for these conditions. And these conditions are osteoarthritis, rheumatoid arthritis, avian, that is an avascular necrosis, traumatic joint injury, fracture, and severe joint deformity, congenital abnormalities, failed previous joint surgery. So here that is an osteoarthritis. What do you mean by osteoarthritis? What is osteoarthritis? So we can divide it into three parts. That is an osteo, which means bone, arthro means joint, and the itis means inflammation. So the inflammation of the joint and bone. Okay. Or we can say that it is a degenerative joint disease in which the articular cartilage gradually wears away. Okay. So here you can see in the image that is a normal joint of the knee, and this is and the osteoarthritis knee. Okay, so in the normal joint there is an articular cartilage, and what is articular cartilage? So this one is a productive covering, and on the ends of the bones, and that allows the joint to move smoothly without any friction, and it's act as an shock absorber. Okay, so think that what happens if these articular cartilage get degenerated or thinned. Okay, if these articular cartilage get thinned, then the bone end rubs together, and there is a formation of bone spurs. Okay, so what is bone spurs? Bone spurs is simply, we can say that in different word, that is an osteophyte, which is an abnormal bony projection, okay, that develops along the edge of the bone or the joint. So if this articular cartilage get thin and the bone end rubs together, so the patient will feel pain. Okay, there is an inflammation in that knee. So for that purpose, the patient will come to hospital for the arthroplasty procedure. Okay, surgery procedure. Okay, so next is rheumatoid arthritis. So we'll see some conditions. What are the conditions are? Okay, so this one is the normal joint, and this one is the rheumatoid arthritis. So uh, in the normal joint, we can say that here is a synovial membrane, and this one is cartilage. This one is cartilage, and when the synovial membrane and cartilage helps in the joint movement smoothly. But what happens in the rheumatoid arthritis? In the rheumatoid arthritis, how it happens when the immune system get attached the with this synovial membrane, and which causes an inflammation in the joint and the joint lining and thickening, and it damages the cartilage and the bone, which leads to pain and stiffness. Or we can also say that this one is a chronic autoimmune inflammatory disorder. Okay, this is how it's look like when arthritis uh, patient. Okay, this one it's look like. So coming to next, that is an avascular necrosis. So what do I mean by avascular necrosis? As the A say, which means an absence, okay, which means an without, and vascular means the blood supply, and the necrosis means the death of the tissue. So the death of the bone tissue due to the lack of the blood supply is known as the avascular necrosis. Simply, normally the bone will receive an oxygen and all the nutrients through the blood vessels. Okay, and when this blood supply get interrupted or it will not, it will reduced, so that the bone tissue will gradually dies. Okay, over the time the bone may weakens and collapse, and this condition is known as the avascular necrosis. Here is in cartilage, and you can see here, here is a normal head and head of the femur, and here is in cartilage. What it happens if the blood supply not blood supply reduced here, so that what happens? It gradually begins to die. Okay, bone tissue begins to die. So this one is necrotic bone, and this condition is known as the avascular necrosis. Coming to next. So, in what will physician do in the arthroplasty surgery? Okay, arthroplasty procedure. Okay, so why it need to be arthroplasty procedure or surgery done when the conservative treatment fails? What is conservative treatment? Conservative treatments like the exercise, some medication. Okay, when this will not work and the patient is feeling so much pain, so in this way, to reduce that pain, he will come to the uh, hospital, and he will just say that he will not feel good. So the surgery will be done. So in the arthroplasty, first a physician will do an incision so that it will expose the joint. Wherever the wherever the, so here is the knee. Okay, so the location is knee. First to find the location, and wherever the damaged bone, so he will do incision in that place, and after that he will remove the damaged bone and the cartilage. Damaged cartilage and the diseased bone will be removed, and after that he will just prepare the joint surface. So why the physician prepares the joint surface, and what is that preparation? He will just trim that area, okay, to smooth that area, so that the implant prosthetic will be fixed there. Okay, what if this preparation of bone will not done? Then you can see that this implant will not fixed. Okay, this implant will not fix if the preparation of the joint surface will be not done. Okay, so that after the preparation of joint surfaces, the physician will place the implant and the resurface that area, or after that he will check the alignment and the stability, and finally he will close that incision. So this is simply in the arthroplasty. First incision, he will prepare the joint surfaces, he will implant the, and after that he will check, he will just balance the ligament and the soft tissue, and the alignment will be done to check the movement, and the incision will be closed. So moving to next, types of arthroplasty. So there are 5 types of arthroplasty you can see. The total arthroplasty, partial, hemi-arthroplasty, revision arthroplasty, and resurfacing arthroplasty. So first, total arthroplasty. The total arthroplasty, for example, you can take knee, total knee arthroplasty. So in the knee, there is how many compartments? There are 3 compartments. That is an patella, okay, medial, and the lateral. So, so in so all the compartment will be replaced or moved. Okay, replaced. So when the entire joint is replaced, that is known as the total arthroplasty. Coming to partial arthroplasty, only the one compartment or one part is replaced. In the hemi, only the one side of joint is replaced. In the revision, replacement of the failed prosthesis. Okay. And the resurfacing arthroplasty, the joint surface reshaped instead of fully replaced. Okay, so we'll see one by one. So here in the that is a total arthroplasty. In the total arthroplasty, here is a knee. Okay, first incision, remove the damaged bone and cartilage, and prepare the surface so that he will place the implant and resurface that area and check the alignment, move for the movement and stability and the closing season. So this is an total knee arthroplasty or total knee replacement. Okay, coming to the partial arthroplasty. Okay, in the partial arthroplasty, first incision, examine that joint. Okay, remove the damaged bone and cartilage, resurface the bone, and give the shape to the bone and place the implant in one part. Okay, after that he will check the stability and the alignment, and and there will be you can see uh, in this one is in total knee, and this one is a single part. Okay, single only unique only one compartment will be involved here. So if one part is involved here, so this one is a unique compartment partial knee arthroplasty, and after that he will close that incision. So only one part is involved. Okay, same process, only one part is involved. Coming to next, there's an hemiarthroplasty. That is an that is only the it is an take the hip. It's an example of hip. Okay, first incision. Okay, to access that area. Okay, to expose the joint of the hip. After that, he will remove the damaged femoral head and he will prepare the surface of the femur. He will prepare the femur and insert the prosthesis. Okay, and after that, he will just that is reduce the hip and check the stability and motion and close the incision. Okay, so here only in the hip there is an femoral head which is replaced and acetabulum which is left in the place. Okay, so only one part partial. So this one is hemiarthroplasty. Coming to the revision arthroplasty, it means that it is an example of knee. So total revision of the total knee replacement. First incision will be done. After that, he will expose the joint and remove the scars and the tissue. Okay, removes the old implant. So old implant has been removed. After that removal of the old implant, he will prepare again the surface and insert new implant. Again check the alignment and the stability, and he will just irrigate and close, and post revision result. You can see here X-ray shows the new revision implant which is in good position and alignment. So he will just remove the old implant and place the new implant. Okay. So coming to next. So before doing the OP reports examples and procedures, we have to see the ICD. Okay. So the M17 series will be the primary osteoarthritis, OA, that is osteoarthritis, right knee, left knee. Okay, bilateral osteoarthritis. AVN, that is an avascular necrosis, that is M87.9. Pain in the left knee and the right knee, M25 series, and rheumatoid arthritis, M06.9. Coming to next. So coming to the CPT, what were the CPT procedures? And so in the hip, there will be a 27130 total hip arthroplasty CPT codes, and 27125, that is an hemiarthroplasty of the hip, and 27131 for the revision of the total hip. Knee arthroplasty, the CPT procedure codes will be the 27447 total knee arthroplasty, and the 27446, that is an partial knee arthroplasty, and the 27486 revision of the knee one compartment and revision of the knee both compartment 27487. Moving to next. Shoulder arthroplasty, the procedure codes will be 23472 for the total shoulder arthroplasty, 23470 hemiarthroplasty shoulder, and the 23473 will be the revision shoulder arthroplasty. So next, what will be the coding criteria for the arthroplasty? First of all, we have to see the operative report. What is the report given? Diagnosis, we have to check that. What procedure performed, whether the joint involved, surgical approach, prosthesis implant, and after that the laterality and location. Okay, whether it is right, left, or bilateral, and the types of arthroplasty we have to see, basically the total, partial, hemi, or the revision. And after that, the diagnosis and implant documentation will be there or not, and the revision status we have to check that, and medical necessity always follows. Okay, coming to next. So we can take the example of the arthroplastic topic. Okay, here is an post-operative diagnosis, that is an primary osteoarthritis of the right knee, and post-operative also same, and procedure is right total knee arthroplasty. So it will match or not. We'll see in the detail. Anesthesia, spinal anesthesia, and operative note. The patient was found in the operating room and placed in sterile preparation and wrapping and standard anterior midline incision with medial papilla arthrotomy was performed, and degenerated cartilage and osteophytes were removed, and the distal femur and proximal tibia were prepared, and the trial components demonstrated satisfactory alignment and stability. Final femoral tibial and polyethylene uh, components were implanted, and the wounds are irrigated and closed in layers, and patient tolerated the procedure well and transfer recovery in the stable condition. So this one is in total arthroplasty. How? So there is a key point, that is an first the cartilage and osteophytes, that is an degenerated, were removed. The degenerated cartilage and the osteophytes, that is the bone spurs, osteophytes and bone spur. And when these were removed, and after that, the second key point, that is, and the distal femur and the proximal tibia were prepared. Okay, that is in compartments, and the trial components. Okay, trial components demonstrated an alignment and stability. Okay, and this component were the implanted. So this will show you the trial component degenerated osteophyte, that is bone spurs and cartilage removed. So these all say that this one is in total knee arthroplasty. So we'll see the navigation. Okay, navigation of this. So first, the primary osteoarthritis of the right knee. Osteo, okay, osteoarthritis. How to navigate? First, osteoarthritis, and after that, it's in primary, and the location is knee, and it's an not bilateral. It's an other specified. It's in right side, not push to code more. Procedures. Okay, M1711. Okay, and next, that is in total the arthroplasty. At the details saying that the total arthroplasty. So we'll just navigate by this. Okay, TKA. That is in total knee replacement. Okay, or total knee arthroplasty. Okay, other specified unilateral. If there is in computer assisted surgical navigation, no. So no. With intraoperative knee replacement sensors, no. No. Okay, it's an PCS table, so don't give attention to that PCS table. Okay, I'm just doing like simply. Okay, okay. So leave that part. Leave that part. Okay. So this code. Okay, 27447. So this one is an arthroplasty. Total knee arthroplasty. What is written? Arthroplasty knee, condyle, and plate to median and lateral compartment with or without patella resurfacing. Okay, and this one is an ICD part. So this is an, and which side? It's on right side, so modifier will be the right side. Okay, so simple, it's and simply a navigation. I'm showing that. So coming to next, okay. So this one is again an primary osteoarthritis of the right hip, and post-operative same. procedure, right total hip arthroplasty, anesthesia, general anesthesia. Operative report: the patient was placed in lateral position and the standard posterior approach to the right hip was performed, and the femoral head was dislocated and resected, and the acetabulum was reamed and prepared, and the SW curve was implanted, and the femoral canal was prepared, and the trial component demonstrated excellent stability and leg length restoration. Final femoral stem and the femoral head component were implanted. The hip was reduced, found to be stable, and the range of the motion and the bone was irrigated and closed in layer. So here, the location is right hip, okay, and the second, that is an femoral head was resected, and the third one, that is an acetabulum, which is a part of hip, okay, component of hip, and which was prepared, and the acetabular cup was implanted, okay, and the fourth one, that is an trial components were uh, implanted, okay, and the femoral head component were implanted. So this trial component checking the stability and movement. So this saying that the total hip arthroplasty. Okay, so we will navigate for this one. Okay, so ICD will be the osteoarthritis. Okay, primary location is hip and it's other specified. Which side is this? This is an right side. So that this one is right side, not pitch to code move. The procedures. Okay, M1611. Okay, and the procedure, what about the procedure? That is an total hip arthroplasty. Okay, total hip replacement. Total hip replacement. Okay, total hip replacement. Total hip arthroplasty or replacement. Unilateral computed assisted navigation. No. So this one is 271330, which is a total hip arthroplasty, and these were the components of hip, that is an acetabular and proximal femoral prosthetic replacement. So the modifier will be the right side. So simply this is a navigation of the total hip replacement or total hip arthroplasty, you can say. So simply a navigation, okay. Come Coming to next, that is an primary arthritis of left shoulder, and procedure is left total shoulder arthroplasty. Operative report: a deltopectoral approach was utilized. Okay, this is a reason where the incision will be done, and the humeral head was resected, and the glenoid was exposed and prepared, and the trial component, that is a glenoid and humeral component, well fit and stability. Final glenoid and humeral prosthetic component implanted, and soldier were reduced with excellent range of motion, and the bone was irrigated and closed in layer. So this one first, the all components of the soldier has been taken, and the prosthetic component were implanted, and this is the reason where first the humeral head was resected, and it was exposed, glenoid was exposed and prepared. Okay, so this showing that this is a total shoulder arthroplasty. So we'll navigate for the shoulder region. Okay, osteoarthritis, primary, um, this one is a soldier. What is the left soldier? What is to go? Okay, M19012. Okay, this one is the ICD for the primary arthritis left shoulder, and total shoulder arthroplasty. So we'll navigate this by arthroplasty. We can also take that arthroplasty. Okay, of the soldier. It's not arthroscopic. Okay, other specified, and it's in total. Okay, so this one is the CPD code for the total shoulder arthroplasty. Okay, and this one is the ICD M19012. Okay, so this one is the navigation of that. So coming to next, that is an We have completed our arthroplasty topic, and we'll do the next topic, that is an arthrodesis. Okay. Um, Arthrodesis. Okay. So this one is an arthrodesis. So first, what do you mean by arthrodesis? So we can divide it into the two parts. That is an arthro and the desis. The arthro means joint and desis means the fusion. So the fusion of joint in order to relieve the pain, in order to improve the stability, to eliminate the joint movement. So this one is an arthrodesis. So we can say that arthrodesis is a surgical procedure in which two or more bones forming a joint are permanently fused together and eliminating the joint movement to relieve the pain and to improve the stability. Okay, it is also called an joint fusion surgery. Okay, unlikely the arthroplasty, where the joint is replaced with an artificial implant, and in arthrodesis, it will remove the joint motion by fusing the joint. So in arthroplasty, the joint were replaced to for the movement. Okay, and uh, and the arthrodesis removes the motion to fuse the bones or joints to improve the stability. Okay, to relieve the pain. So this one is arthrodesis. So why arthrodesis is done? What are the conditions? So to correct the joint deformities, failed joint replacement or congenital deformities or the chronic infections, and to relieve the severe pain, treat end stage arthritis, to correct the joint infirmities, and the common joints for ankle, wrist, thumb, spine, finger joints. Okay, so this is simple. Coming to next. So what will physician do in the arthrodesis procedures or surgery? So when the conservative treatment fails, that is in medication and exercise, as we previously discussed. So if this fail conservative treatment, so that a physician will do arthrodesis surgery, okay, procedure. He will expose that joint. He will remove the damaged bone and cartilage, prepare the bone surface, place the bone graft if needed. Alignment of the bone will be done and fix them with the screws, rod, or staples or plates and close in season. And after some time, the bone will heal into one solid bone. It means fusion of the joint done, so bone will heal. Okay, coming to next. So these were the I series of the arthrodesis, that is in primary arthritis, that is an M19 series. Rheumatoid arthritis. In the arthroplasty and arthrodesis, some conditions are same, but the treatments are different. So whenever the doing the OP report, we have to check the medical necessity, and we have to check the ICD, and we have to check the procedures. What are the procedure done for that condition? Okay, for that condition, sometimes arthroplasty is also done, arthrodesis is also done. So we have to check that. Okay, moving to next. CPT, these were the common CPTs: ankle arthrodesis 27870, ankle arthrodesis with the graft, that is 27871, triple arthrodesis of the foot 28715. First MTP joint arthrodesis 28750, wrist arthrodesis 258000, 805, 820, interphalangeal joint arthrodesis 26860 spinal arthrodesis. Some multiple CPT code based on the spinal reason and the approaches also. Moving to next. So these were the coding criteria for the arthrodesis. That is a medical indication for the fusion. Joint and anatomical side is very important. Laterality we have to check, and joint preparation and bone and cartilage has been removal, and bone surface preparation. Graft is used if applicable. Internal fixation will be done if used, and successful fusion will be done. Alignment of the fusion. So these were the coding criteria. Coming to next. So what is the difference in arthrodesis and arthroplasty? We already discussed that. First, in the arthrodesis, there will be fusion of the joint, and arthroplasty, replacement of the joint or the repair of the joint. No joint motion after healing, and there will be the motion and this will be done only for the joint motion restoration and used for the pain relief stability, used for the restore the function and relieve the pain. So what were the key points in the arthrodesis? So arthrodesis, there is a joint fusion, and here is a joint movement elimination to relieve the pain and to provide stability. And joint cartilage is removed before the fusion, and bones are fixed together using some hardwares and bone graft. ICD based on the underlying diagnosis, and the CPT selected based on the joint involved, and the specific arthrodesis technique documented. Coming to next, so this is an example I'm giving that for the arthrodesis. Okay, the primary osteoarthritis of the right ankle, and the procedure performed, and the post-operative is also same, and the procedure is right ankle arthrodesis. And the operative note, that is the patient was out to the operating room and placed in the supine position. After the induction of the anesthesia, the right ankle was prepped and wrapped in the usual sterile fashion, and the standard anterior approach or to the ankle joint was performed, and the articular cartilage was removed from the tibial placard and the talar bone, and the joint surface was prepared to expose the bleeding calcaneal bone, and the ankle was positioned in neutral alignment, and fixation was done using multiple cannulated compression screws, and the intraoperative fluoroscopy confirmed satisfactory alignment and the hardware placement, and the wound was irrigated and closed in there, and the sterile dressing and splint were applied, and the patient tolerated the procedure well, and the transfer to recovery in this stable condition. Okay, so in the OP note, what were the key points here? You can see that the first, the incision is done. Okay, first, no, first the approach is the anterior approach will be there for the ankle joint. This one is the location, this one is a reason, and the approach will be the anterior approach. And the second, the articular cartilage were removed. Okay, and the joint surface were prepared and to expose the bleeding calcaneal bone, that is in fusion. Okay, and the ankle was positioned in the alignment and fixation was done, and the fluoroscopy confirmed the alignment and hardware placement will be there. So this one says that it is an arthrodesis procedure, the expose of the bleeding calcaneal bone and alignment, and fluoroscopy confirms alignment and the hardware placement will be there. Okay, so we will navigate that procedure. Okay, so first, again, osteoarthritis primary. It's an angle. Which side? This one is right side, not this to forward more. Okay, M1907. One is an ICD for that primary osteoarthritis, right ankle and foot. Procedure, that is an arthrodesis, right ankle arthrodesis. So we'll navigate by the word or the letter arthrodesis. Arthrodesis. Arthrodesis of the ankle. This one is nothing. Other specified will choose. No arthroscopic. Other specified. Bone graft performed. No. Okay. 27870 with the modifier right side. So this one is the arthrodesis 27870 CD CPT code. So this is an ankle open for arthroscopic. When there is an arthroscopic arthrodesis of the ankle, then we use that CPT code 29899. Always check whether it is open or whether it is an arthroscopic. Okay, and this is an arthrodesis tibiofibular joint proximal and distal. Okay, obviously check that table and whatever the written in the procedures. Okay, so we have already completed all the topics, and the last and only the two topics were there, that is on hardware removal and the excision of soft tissue. So today we have completed. In the next video we'll see that two topics and the musculoskeletal system. completed. In the next, we'll see the respiratory system topics. So, okay, guys, just like and subscribe my channel